Hello, cherished viewers. I am delighted to extend a warm welcome to all of you on my channel. My name is Marat Khazibovich Valeev. I am a cardiologist. And today I would like to discuss such a relevant topic as how to lower blood pressure levels at home. There are two main methods. You probably know that. In order to understand where to start with medication or non-medication treatment, you need to understand what is considered high blood pressure. For instance, if you measure blood pressure and have a value of 140/90, do you need to reduce in this scenario or not? The question is quite controversial because for many, especially in the age group of citizens or, for example, patients who are overweight, 140/90 can be quite normal pressure and does not need to be reduced. If, for example, you are hypotonic, that is, you are used to low blood pressure, that is, normal for you, for example, 110/70, and you saw a value of 140 and above on the tonometer, in this case, of course, it is more advisable to lower the pressure. First of all, you need to determine for yourself whether you are being observed for hypertension or not, whether this diagnosis has been established for you or not, and what is your current blood pressure. If, for instance, you measure the pressure and observe a value above 160, 90, 100 on the tonometer, then in this specific case, I would definitely recommend medication to lower the pressure levels in order to ensure optimal health and well-being. Of course, not a drug effect. Let's start, after all, with the situation when you measured the pressure, so high numbers for yourself, and made a decision, so to speak, to fight this situation. Well, first of all, you need to determine whether something bothers you or not, because in many cases, patients measure their blood pressure, see, for example, the same 140 or 150/90 or 100, but at the same time feel absolutely normal. So they measured the pressure just because the device was nearby, decided to measure, and saw high numbers there. In that instance, I wouldn't decrease it if you feel sufficiently well. It is evident that if your blood pressure is higher than 160/100, then in this particular situation it is recommended, naturally, to reduce this pressure. Drug treatment. There is a diverse array of medicinal drugs that are available for use in a wide range of conditions. Certain medications become outdated as time elapses, while novel medications emerge and come into existence. The main one for today, and it is kind of present in many recommendations, the simplest, relatively inexpensive one is the drug captopril. Captopril is its, so to speak, international name. There are quite a few trade names for this medication. I will not list them here. I believe you are aware of it, or you can search for it on the internet. Captopril signifies that it is among the most fundamental medications that rapidly reduce blood pressure. This is an emergency remedy, which implies it is not taken for regular usage, but rather required solely for the purpose of reducing blood pressure on a single occasion. And I am frequently asked this question: how should captopril be taken in the end? In reality, many doctors mistakenly prescribe the medication captopril sublingually, meaning under the tongue area of the mouth. This is an outdated opinion without any, so to speak, evidentiary conditions that need to be met. Captopril is taken orally. If you read the instructions for the drug captopril, it is clearly stated that the drug is taken orally once or twice daily, depending on the specific situation at hand. Regarding the sublingual technique, I believe we should forget it. The medication is ingested orally. It is also very important to note that if you have taken a medication such as captopril or any other, there is no need to measure your blood pressure every 5 minutes, because the medication takes effect within 20-30 minutes. You still need to wait, I believe, for at least 30 mins, or preferably 40 mins, and repeat the BP measurement, then decide. Many patients will take one medication, measure their BP after 10 mins, see that it is high, and take a second medication. Thus, this causes the patient's blood pressure to drop after an hour, and these fluctuations, namely a sharp increase, can result in worse consequences than high pressure alone. Also, one of the common drugs today, along with captopril, which is also quite popular, is maxonidine. There are also numerous trade names, but this is a centrally acting medication. Also highly effective, it is utilized for continuous intake. However, as a general rule, it is prescribed in combination with other medications, so to speak, first-line medications. Maxindin is not a first-line drug, that is, it was not initially prescribed, so to speak, just like that, but as an ambulance, that is, a good medication reduces blood pressure rapidly and effectively. Thirdly, I believe from this list I would incorporate the medication nifedipine in this case. Moreover, the medication is highly effective, rapidly reducing blood pressure and swiftly eliminating toxins from the body. Also, the drug is a fast-acting drug. In general, It is necessary to distinguish between drugs that are used for continuous intake rather than drugs that are used as emergency aid. They have different actions, so to speak, eliminated faster. Before taking any cardiological medication or any other medication, regardless of the kind, I would recommend you, regardless of whether the doctor prescribed it to you, or you prescribed it to yourself, or you heard about it somewhere, or maybe someone you know took this medication, always read the instructions. Because usually there are contraindications written there. Maybe you have a disease not compatible with this medication. Therefore, self-control is certainly very important in this case. It is necessary to read the instructions before taking any medication. Now, regarding non-drug ways to reduce pressure, there are many, so to speak, but I want to focus on the basic ones that I find most effective. In general, non-pharmacological approaches can be applied locally. They can be utilized in combination with the administration of medications. To reduce pressure with a non-drug remedy, I recommend taking a comfortable position, ideally a sitting position, and trying to relax as much as possible. Sit with your eyes closed for 2 to 3 minutes and focus on your breathing. Pressure can rise due to emotional experience or stress, not necessarily because of hypertension. Even normal, healthy people can have increased pressure due to emotional overload. It's important to prioritize relaxation and breathing techniques to alleviate pressure and promote overall well-being. No need to rush to the pharmacy for medication. If your blood pressure is above 160, try to lower it with non-drug methods instead of taking immediate action. First of all, the position of the body. Try to relax as much as possible. And very effective, of course, this is breathing exercises, or as it is called, diaphragmatic breathing. The diaphragm is a muscle positioned between the chest cavity and the abdominal cavity and helps us with breathing, if you can say so. To understand how to correctly apply diaphragmatic breathing, it is enough to put one hand on the chest, the other on the abdomen, and try to breathe. You'll understand how you breathe after all. Either the chest moves more or the stomach moves more. So diaphragmatic breathing is when we actually refer to it as the abdomen. So you inhale, exhale, and you observe how the hand that is positioned on the stomach, it slightly protrudes forward in a noticeable manner. So you write with your stomach and diaphragmatic breathing, literally for 5 to 10 minutes, and you can achieve a pretty good effect. Why am I saying this? Because I myself, so to speak, am inclined to this. I do not take any medications, but my normal pressure, which usually always exists, is about 130/80, sometimes even 140/80. For this reason, I regularly utilize breathing exercises and can confidently affirm that it is truly effective in every possible aspect. So I tried it on myself. In general, I try not to recommend to my patients something that I myself have not really encountered and have not really seen, so to speak. Read this one, obviously. Watching a video is completely different. But when you face a problem face to face, and even better, when you face a problem personally, then, obviously, the effect of recommendation, I believe, is the best. Therefore, I can prescribe and say that breathing exercises work. No less effective, of course, would be physical activity in the form of walks, going outside and trying to take a walk. Ideally, around 30-40 minutes. No need to run, no need to run super intensively, but you can take a brisk walk. Clearly, one must soberly assess the situation here. There is high pressure, approximately 170/180, right? Is that correct? Terribly painful head there, occiput. It is clear that you are unlikely to force yourself and go for a walk outside. Well, you can utilize breathing exercises in this instance. There is nothing challenging here. By watching videos and reading recommendations online, you won't be satisfied, so you need to evaluate comprehensively, taking into account various factors and sources of information. In any case, if your blood pressure rises, and it rises often enough, and you pay attention to it, and it bothers you, it somehow manifests itself. Headaches can be a symptom. These can be pains in the occipital region, dizziness in certain cases, and a sensation of nausea may be experienced. Sometimes there is such a thing as flickering flies before your eyes. It seems like flies are flickering. also one of the indicators of high blood pressure. Naturally, in an ideal situation, it is deemed advisable for me to initially seek advice from a doctor in order for him to perform preliminary tests and determine the appropriate course of action regarding your health. I would also like to note that it's generally my own business. Regular physical activity, of course, allows to normalize, albeit not completely, but sufficiently effectively reduce blood pressure. Either it's walking, maybe swimming, skiing, cycling. So you can choose a comfortable type of sport for yourself, which suits you the most, so to speak. And commence with something small. You do not have to instantaneously start participating in marathons, but gradually and smoothly enhance the amount of physical activity you engage in. So it should be a pleasure. I would also like to talk about such a technique as various types of massage, there on the neck collar zone, head massage. But honestly, I do not know how effective it is. Yes, many doctors recommend it. But I would still approach this with caution because massage in general is a fairly complex manipulation. Specialist qualification is crucial, of course. Avoiding wrong pressure is vital. Stretching the wrong muscle can constrict a vessel or cause other issues. You can only make it worse. Therefore, if you are not sure that the doctor is really knowledgeable in the subject, that he really understands, so to speak, in this area, I would certainly not use such a methodology. In summary, pharmacological and non-pharmacological approaches can be combined to effectively reduce blood pressure using a combination of methods and techniques. It is more reasonable, of course, to start with medicinal methods of reducing pressure. One should pay close attention to their health, including measuring blood pressure. You don't need to fanatically measure it every 5 minutes. This usually doesn't lead to anything good. Certainly refrain from making independent decisions. Instead, seek guidance from a qualified medical professional. Thank you for watching. If you have any questions, you can leave them in the comments. I will try to answer them. Ensure you subscribe to the channel to not miss the next relevant topic. We'll be waiting for you in the next video. Take care and goodbye for now.